Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, I've reviewed your medical history, and it seems you've recently been experiencing some discomfort in your breast area. Can you tell me more about that?
Yes, it started about a week ago. I noticed that my left breast was quite swollen and it felt tender to the touch. Initially, I thought it might be related to my menstrual cycle, but the pain intensified over the days, and now it feels like a burning sensation, especially when I breastfeed my 2-month-old son.
That sounds concerning. Have you noticed any redness or warmth in the affected area?
Yes, there's a reddish-pink patch on the upper part of my breast, and it feels warmer than the rest of my skin. There's also this lump that I can feel, and it's quite painful when I touch it.
I see. And have you experienced any flu-like symptoms? Chills, fever, or fatigue, perhaps?
Actually, yes. I've had a mild fever for the past 2 days, and I feel more tired than usual, which I initially attributed to the sleepless nights with the baby, but now I'm not so sure.
It's essential to differentiate between general fatigue due to new motherhood and fatigue due to a possible infection. Regarding breastfeeding, have you noticed any changes in your baby's feeding patterns or behavior?
He's been fussier than usual and sometimes pulls away from the breast during feeding. I thought he might be colicky, but now I wonder if it's related to my condition.
It's possible. Babies can sometimes sense when something's not right. Are you experiencing any nipple discharge, especially any that appears unusual?
Not that I've noticed. The milk seems to flow just fine, but the pain makes it difficult to continue feeding for long.
Understood. Mastitis is an inflammation of the breast tissue, often due to an infection, and it's not uncommon in breastfeeding mothers. The symptoms you're describing seem to align with that. However, we'll need to run some tests to confirm.
I was worried it might be that. I've heard of mastitis, but never thought I'd experience it myself. What can be done about it?
Treatment usually involves antibiotics to clear the infection. It's also essential to keep breastfeeding or pumping to ensure the milk ducts don't get clogged, which can exacerbate the condition. Warm compresses can also help alleviate some of the pain and inflammation. We'll discuss a detailed treatment plan once we have the test results.
Thank you, doctor. I just want to get back to normal and ensure my baby is getting the best care.
Absolutely. And we'll do everything we can to ensure that. Let's start with a physical examination and then proceed from there.
Extract 2, questions 13 to 24. For questions 13 to 24, Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. How can I assist you today?
Doctor, I've been experiencing frequent urination, increased thirst, and constant fatigue for the past few months. I'm worried it might be diabetes.
I understand your concerns. Have you noticed any unexplained weight loss or increased hunger?
Yes, doctor. I've lost about 10 pounds in the last 2 months without trying, and I'm always hungry.
All right. Do you have a family history of diabetes?
Yes, my father has type 2 diabetes.
Noted. Are you currently on any medications, or have you been diagnosed with any other conditions?
No, doctor, I'm not on any medications, and I haven't been diagnosed with any other conditions.
Do you engage in regular exercise or have any specific dietary habits?
I walk occasionally, but not regularly. My diet is a mix of everything, but I do have a sweet tooth.
How about alcohol or smoking? Do you consume any?
I drink occasionally, but I don't smoke.
Thank you for the information. Based on your physical examination, I note that you are overweight with a BMI of 28. Your blood pressure is 190 mmHg. Pulse rate is 78 BPM. And your saturation is 98% on room air. Upon inspection, I see no signs of skin infections, but there is some darkening around your neck and armpits, which can be a sign of insulin resistance. Your feet show no ulcers or cuts, but there is some loss of sensation. I've reviewed your blood tests, and your fasting blood sugar is 140 ml, and the HbA1c is 75%, which is above the normal range.
What does that mean, doctor?
These results suggest that you have type 2 diabetes. The darkening of the skin, called acanthosis nigricans, and the numbness in your feet indicate that you might have had elevated blood sugar levels for a while. The HbA1c test gives us an average of your blood sugar levels over the past 3 months, and a result of 7.5% confirms the diagnosis.
Oh, I see. What should I do next?
First, don't worry. Diabetes is a manageable condition. We'll start with some lifestyle modifications, including a balanced diet and regular exercise. I'll also prescribe some medications to help control your blood sugar levels. Regular monitoring and follow-up appointments are crucial. We have a dedicated diabetes care team that will guide you through the process and provide all the necessary support.
Thank you, doctor. I appreciate your guidance and support.